Burgess.
Mr Speaker, it's a real pleasure to stand up here on behalf of the Health Committee this afternoon and speak on this piece of legislation. Now, actually, it's about 7 statutes and it's about correcting all of those in order to be able to let our nurse practitioners operate in a way that will be really, really useful for our society. And, you know, we've heard a lot about Mrs King today and her introduction of nurse practitioners. I actually think the introduction of this piece of legislation is extremely exciting, and it really is only the beginning of a number of things that we can do in this area. And some of those have been outlined today in terms of how we may be able to expand on this in the future. Because really it is about primary care, it is about people being able to get access close to home to their health services, and as we've heard about this afternoon, it is really, really critical in our rural areas, not only for people to be able to get closer to home, but actually for our nurse practitioners also to be travelling closer to the people. And so this government is dedicated to developing this pattern further, investing in areas which will allow care to be delivered this way. And so this bill is a key step in actually helping us enact what we are working on. And so I welcome the change along with the committee, and I welcome this opening up to nurse practitioners of a whole range of things. And what it's doing is it's removing those legislative barriers that we currently have to innovative practice, and so that's why I find it quite exciting, because since I've been in Parliament as a Member of Parliament, which has only been a short few months, I've actually been tracking around and looking at various health services in the electorate, and particularly in relation to rural ones. And I had a really, really fantastic experience where I watched an operation on the mobile surgical bus that actually travels around the country on a 5-week cycle, and the nurses from the various health boards actually participate in the area when the bus comes to that area. So there's an opportunity for nurse practitioners to get more involved in terms of the scope of their work and be able to do more and help people closer to where they live.
Order.
So we also, you know, when we're talking about health, we talk about things like telehealth, and we talk about Skyping health. And so I think this is really important. Our rural broadband initiatives are really going to help us to be able to then even bring those nurse practitioners closer to where people live once they have the ability to work with that equipment with the rural broadband rolling out across the electorates. And we also heard the member Clark talking about, you know, buildings, and some buildings perhaps losing services and buildings not being up to scratch. But I am really heartened in places like Te Awamutu, where we had a building that was pretty old and dilapidated that was being used for midwifery, and now that building has actually closed down, and there's a core group of midwives who have actually started their own business, and they are putting a purpose-built building in. And so no longer in the rural areas we can't live close to a big hospital in a lot of situations, but we can make purpose-built buildings. And what I'm finding in a number of areas, and I've just been recently out at the Chamber of Commerce in Raglan, where they're talking about building a purpose-built health centre. And so from that aspect, we can have all sorts of nurse practitioners and all sorts of people who will come into the community and be able to work on that, which saves people travelling long distances. The other thing that excites me a lot about this is we currently have a lot of nurses who are travelling long distances to get to specific locations to do the job. The patients are also travelling long distances to those specific locations to get their medical help. And if we can actually allow some of those nurse practitioners to do things more closer to their home and also closer to their patient's home, then it certainly is going to give us a faster primary health care, because it's going to save a whole lot of people travelling around. So I really welcome that change. And the other reason I welcome that change is because we've got 40,000 nurses who are working around the country, And recently I was asked to speak and open the Rural Nurses Conference. And there are a huge amount of rural nurses who are living in our communities, and actually the average age I found out of those rural nurses is 55 years of age. And there's a lot of women who are actually out there that are actually taking huge pride in the work they do, but can't take any further steps in their career because of being limited, because they're not able to undertake some of the duties that we're trying to open up for them today. So I think in terms of those particular people, it's going to give them the opportunity, if they don't already have the nurse practitioner qualification, to be able to then go and get extra qualifications, and they'll be able to build their own career while they're actually still living close to home. And I wouldn't say necessarily for a lot of them close to home where their children are. In some cases they actually have grandchildren in their community, so it gives them an opportunity to be able to continue their career for quite a long time. So really it is about a more flexible workforce. It is about people being able to be accessed from all around the community, and you know, we would actually love to have more doctors out in our rural communities, and that'll be part of the scope of hoping that we can work more closely with them to get them out there. But this step will actually give them a whole range of people that they can work with, and it'll be able to open up the scope of what we do in some of our rural places. And all that I've read related to this change in this piece of legislation, it is a low risk to public safety. These nurse practitioners are very, very capable people, and it would really it would engage those people to far better ability in our rural communities. So what's really important for me is access to health. And I think since I've been on the Health Committee, and I do enjoy being on the Health Select Committee, it is a group that works extremely well together. We have a great collective of people and skills, you know, a lot of it we talk about is that access to health, people's access to primary care, and doing this in terms of what we're trying to do today will make it easier for the public to access timely and effective treatment. And you know, what we've also got is if people can't access timely and effective treatment, people will actually go and start self-diagnosing themselves. We've also got they're doing it now. We've actually got a wonderful initiative going on at the moment in our rural communities, where we've got a doctor who used to do a TV series called Dr. Global. His name's Dr. Tom Mulholland, and he's bought an old ambulance, and he's actually going around rural communities, and he's doing health checks, he's doing blood pressure, he's doing diabetes, he goes out into rural areas like Wongamomina, he's been at field days, he's travelling the country. A lot of those people wouldn't actually get up and go to the doctor, and he's picked up a few reasonably serious health situations just from those checks where he can sit in the community. And it's quite amazing. You can sit for 3 hours in a community hotel where he comes in, and everybody takes their turn, and it's quite a supportive attitude where people are supporting each other to get these health checks, and they're actually looking after each other. So I think, you know, he's a qualified doctor. If we can get more people even out there being able to do those basic specific checks, and health can come to the community rather than the community going to health, then we're going to have a far better society. So, Mr. Speaker, I'm supporting this bill, and I'm looking forward to being part of it. Thank you.
Eugenie Sage.
Thank you, Mr. Speaker.